Diana Wang of Open Mat Physio, welcome to the show.
Thank you for having me. It's great to be here.
Awesome. Let's dive right in. What is the biggest challenge you have as a doctor of physical therapy working with jiu-jitsu athletes?
Ooh, okay. So yeah, we're diving right in. I think in terms of, we can go at it from a couple different angles, right? So I think one of the biggest things, if we're looking at from the rehab side, is kind of a bit of the mindset of no matter what, I'm just going to keep pushing through. No matter what, I'm just going to keep doing it. I think partially that comes from when they have gone to prior medical providers who have just told them the only way to get back to training or to even do anything is to just quit jiu-jitsu. Is the only way to manage your injury is to quit jiu-jitsu. That obviously is not a good enough answer. So what are they going to do? Just ignore it. So it's almost like now coming from this angle of, I'm not going to tell you to quit jiu-jitsu. I'm going to actually give you tangible ways to get back to training. But there's always that like ingrained mentality of, I'm just going to push it a little bit more. I'm not going to really listen to you 100%, but maybe it's just from past experiences of like, you know, trust with healthcare providers. So on that side, I think it's a bit challenging, but then that comes from my job of building trust and building trust with the community and building trust with our clients of saying, I promise you, my job is I'm not going to be here to be the one to pull you away from training. I want to actually push you closer and closer towards it. But you have to trust that our scaling back certain things is actually helpful for you because we need this time to be able to push you forward. So I think mindset wise, that's like one of the most challenging things.
Yeah, that's kind of interesting because it's like you're putting on this constraint of like, okay, we are going to operate within the bounds of you being able to still do jiu-jitsu. Like,
yeah.
We're not removing that. But now with that in place, how do we get you better?
Josh just found a way to
I
make that
constraints in
you
there.
definitely work constraints in there. Josh is going eco on you right now.
always
I can appreciate.
I didn't mean to, but I
the way you structured that as you were saying it, I was like, are you
constraints
talking about
and made
that?
a box.
Yeah.
Pass box right here.
Yeah.
For those of you watching, we trained this morning.
Yes.
Diana came and she trained with us. And
There's
we
a clip of it right here. Now you have to put that in.
fucker. All right.
No, you have to edit.
Yeah, I do have to edit it
Right
in.
there.
Yep. Okay. So very good.
But is that how you kind of look at it though? You're like, okay, we are gonna have you like continue to train. You don't have to stop.
Yeah.
Jiu-jitsu. Okay.
And I think in the very beginning, I had a hard time communicating that to them because I didn't have the reps to be able to do that yet. To say, I'm not here to pull you off the mats. But as time has gone on, the more people that I've worked with, the better refined the communication is. And I'm just straight up now with all clients. I'm like, we're not like your typical physical therapist that's going to say you need to quit something in order for you to get back to or to be able to like live a pain-free life or whatever. My job is to literally shuffle things around. Like, again, put some constraints and some guardrails for now based off of what your body can and can't do. And then we're going to slowly move the needle closer and closer to you being able to get back. And then throughout the entire process, we're having that conversation of every month that passes by, where are we? Are we where we should be? If we are where we should be, then this is our conversation of stepping into step one of getting you back to training and then slowly progressing that.
Why is it though that like when you go to a doctor traditionally, like because it's almost like a meme, I feel like in jiu-jitsu. It's like, oh, I tore my meniscus and I went to the doctor and he said, okay, yeah, you gotta stop jiu-jitsu. Like why is it that that's the default answer, do you think?
I think about this a lot as a PT, and I think part of it is the lack of understanding what jiu-jitsu is. That is more of the niche side of, okay, if I don't understand it, then I just have to, one, protect myself. Because as a doctor, if they give out advice and then someone doesn't, they're like, but my doctor said you're in for, a lawsuit or something, right? But I think the second part is because that's kind of like the old school mentality of medicine is the first thing we're going to do is give you drugs. And then now it kind of progressed to like, okay, now we're going to give you shots. And then if that doesn't work, then we're just going to go straight into surgery. But add on top of that, the layer of jiu-jitsu being so complex and so nuanced and so niche, they're like, I literally don't know how to handle this. I don't know what that is. Yeah, just don't do it. I think it's
Yeah.
bad for you. Just don't do it, you
Yeah.
know? So I truly don't think doctors are coming from a place of like being malicious or trying to harm somebody. I think it's just a lack of knowledge and a lack of understanding of what jiu-jitsu is and where best to direct somebody to get them back to doing that.
Right.
Yeah.
Right. And I feel like even in just the subset of doctors who are doctors of physical therapy, there are kind of two camps. There's ones who, like you said, well, you shouldn't do this. You're going to have to get a shot or whatever, and, you know, kind of mask the problem. And then there's another camp that's like, let's get you closer to what it is that you want to do. And I would just like to applaud you for being in the latter camp, because I think that's, you know, from maybe a mental health perspective is so important. Is like you said, people are just going to do it anyway. So why not work with them and work with the grain instead of against? So good job.
That's something that we talk about a lot too, is when we are working with our clients or anybody, when we have this discussion, is that jiu-jitsu, if you're in the community of jiu-jitsu, you understand that it's not just like a hobby. You're in it, and a lot of times it becomes a really big part of your life. It becomes almost like an identity, a part of your identity. Josh is like, oh, hell yeah.
I got some tattoos.
But, you know, like when we can really, as healthcare providers, understand that it's part of people's identities, then we might be a little bit more careful of saying, don't do that anymore. Because if you really think about it, you tell somebody to not do something that is part of their identity, you strip that away. Now, what are they going to do? You're almost like robbing them of something that they care so much about. And they're like, now, like, am I supposed to go find something else? And then you kind of fall into this mental struggle of trying to figure out what you should do, right? So we always talk about treating jiu-jitsu athletes as a person, and we have to look at it from all different angles. Okay, the physical side, but there's also a big part of the mental side. And we use that same, I guess, philosophy while going through the rehab process, because we understand that this is such a big part of your identity. This is something you define yourself with. And if we can get you back to it, then not only are we giving you back your ability to stay fit, stay healthy, do something with your body, which we always talk about, moving your body, but then also we're giving you back your mental health, we're giving you back your social circle, we're giving you back so many more things that are outside of the realm of what we would deem as physical therapy.
Yeah. That's really powerful.
What is like I'm a complete noob in like physical therapy, obviously. I have no idea. What is like the thesis of it? And like, so what are you doing that is like different? Oh, I guess the first part of the question is like, what is the underlying thing that you're trying to get people to do? For example, like in my head, I immediately think of like the things that you have me do, which is being able to get more mobility by being able to like move at end ranges of motion. Like, what is like the underlying thesis? And then like, how do you take that and then put that within those constraints?
The pass box.
Yeah, the pass box.
How do we move through the pass box?
And so, and then how do you take that thesis now with this understanding that people aren't going to like stop doing jiu-jitsu and then apply that? And how is that different than like what might traditionally happen?
Yeah. So I think one of the things that we always want to encourage is movement. So Matt does a really great job of maintaining your movement to start to improve mobility and all these things, right? The tricky part is when pain is involved, because then we have to look into like the psychosocial side and look into why their pain sensitivity is so high in certain positions. So I think to I guess answer your question is, the first thing is we need to understand their medical history. So what have they experienced? We have to understand how jiu-jitsu plays a role in their life. And then we also have to understand how they view their perspective of their injury, how that's affected their life, and then their perspective on pain. Once we can understand that, then we know how to dive into, because the movement stuff, the assessment stuff is more tangible to see, but the other thing, the conversation, is a little bit more complex. Then we go into the movement side, and I guess what I've seen is different in a traditional PT setting versus what we do is that my objective in a movement setting is, of course, keeping in the back of our heads that pain is always going to be present. When is it present is going to be more important to me than the fact that it is present. We're going to look at what you can't do, what you can do, what you need to do, and then we're going to build a plan on how we get you back there. And as simple as it sounds, it's about understanding how to look at the body from a full body perspective, and then being able to figure out, okay, these are some of the most foundational activities or exercises that you are having troubles with. We have to nail these down before we can move on to anything else. And then understanding the strength and conditioning side of using with pain on top of that, how we can start to scale somebody from what they are currently able to do more and more closer to being able to function as general GPP, right? Having like enough strength, stability, endurance. And then you have that conversation about getting them back to training. So it feels like it's something easy to do, but I also think it's a lot of it is nuanced and understanding really well regressions and progressions of exercises.
100%.
If you know how to, like, this is an example we give to a lot of like our clients or friends is just because you have pain in a squat doesn't mean we're just going to throw away the squat.
Right.
We're going to find a different way
to squat.
Get a different way to squat,
Yep.
or we're going to find a different exercise that can give us the same stimulus
Yep.
to get the same goal.
Yep.
It's like eco, like, right? Bring it all the way back to eco. You know what I mean? It's like there's so many different ways to do something, but if you're creative enough and you're able to think outside the box and not just like, oh, you can't squat, we're not squatting.
Right.
Then you're going to be able to come up with solutions that can give this person at least, maybe you want to build some quad endurance. You want to start to stimulate some of the core muscles or things like that. There's millions of exercises you can choose. You just have to work within what they can and can't do.
Right.
So I guess that's a little bit. And then as we get closer to jiu-jitsu, then understanding athletic development principles of just what do they need for jiu-jitsu? What is their game like? You can dive a little bit deeper into that. But we always look at everybody as an athlete. And athletes need to build a foundation. If you have a rocky foundation, when you start doing harder things, something's gonna fall apart, right? So we have to make sure that we build a good foundation.
Yeah, that's so validating to hear. Actually, just we say all the time, like, we don't fit the person to the exercise.
Yeah.
No, we don't fit the person to the exercise. We fit the exercise of the person.
Totally.
Right. We're always like, what can this person do? And if just because they can't squat doesn't mean we don't squat. We just squat differently, or we find a different variation of a squat.
Yeah.
So it makes me happy to hear that.
It's
We're
also
doing
more,
the right things.
Is your microphone working now?
My microphone is working. I am getting waveforms here.
Okay, sorry.
Yeah.
I was just
not picking up something.
It's totally okay.
Okay.
I'm leaving this in the podcast.
Leave it in. All right.
Yeah, I think one thing that we usually try to, and a problem that we see a lot in like the physical therapy world, especially for anybody who is not just, my goal is to walk, right? Is PTs are so scared to push their patients. They're so scared to stress their patients.
Yeah.
But we come from an angle where it's like, no, we're going to stress you. We're going to push you.
Yeah.
But we're going to do it in a safe way.
Right.
So and this is why communication is so important in the way that when we work with our clients is when we're doing an assessment, I'm always asking questions. I'm always asking, okay, in this position, like, what does it feel like? Does it feel like a stretch? Does it feel like pain? Does it feel like a dull achiness? Because these pieces of information is going to tell me whether or not we can continue with the exercise, or we need to find a different variation, or we need to scale back, things like that. But one of the things that people always tell us after our assessment is like, oh my God, I didn't expect to be this sweaty. It's like, you better expect that for the next 6 months, because we're going to push you.
Yeah.
And what I see a lot is like PTs are scared to push because they don't know what's going to happen. Mm-hmm. Like, you don't have that experience of pushing your clients or pushing people, that you are afraid you're going to hurt them. But that's why, of course, having some experience helps, but also doing it yourself. Like, you need to put yourself in that position.
Yep.
Okay, if I do this, like, I'm not actually going to hurt myself. It's actually going to put me into a more stressed state where I know when I need to stop. Like understanding RPE or perceived pain or things like that. Mm-hmm. But being able to really know how to push your clients and moving the needle is how we get people stronger, more stable, like have more endurance, and then eventually be able to handle more difficult things.
Yeah.
So.
This regression and progression thing is the most interesting thing that I got. Well, one of the several interesting things I got from that, because I hurt my AC joint. I got, it was like the medic at the jiu-jitsu competition, he just randomly said, he was like, oh yeah, it's probably a grade 2 AC joint separation. So I was like, okay, I'm just gonna call it that from now on. I didn't get like an MRI or anything like that.
He's
but
probably right though. I think I saw the video of yeah, I think I know who that guy is. He's a good guy, super smart. Very good PT.
He was telling me he's got a YouTube channel too where he talks about all this stuff like that.
Yeah,
interesting.
That medic, yeah.
Sick.
Yeah, no, he was cool. He was super cool. Shout out to him. I forgot your name. But,
Shout out to him.
thanks,
Let's
bro.
go.
Matt will put that right here.
Josh,
giving him more and more work. I love it.
Josh's favorite thing to do on this podcast
Yeah,
is
if
do
this is
things
the
that I have to cut
dynamics,
out, that I have to edit. Yeah.
But after that, I started like just like figuring out, because I couldn't like lay on my side. Like there was a lot of stuff I couldn't do. But I was like with my little exercise band, it's in here somewhere, like one of those stretchy bands, just going outside and just walking like literally for miles, just like doing all these exercises to see how far I could go, like with the AC joint where it would start to have pain, and then try to exercise from there and do all that kind of stuff. And I don't know, I feel like I PT'd myself.
Just real quick,
Yeah.
If I may interject.
Yeah,
As
sure.
Josh's strength coach, I did ask, is this something you might want to see a physical therapist for? And he was like, I think I got it. And I was like, okay. But I did suggest that he seek professional help.
He did, and I'm not, and I don't mean this at all to say that like the anybody can be a PT, like and PT themselves. I don't mean that. But the question I was getting at is because you were like saying with the clients you're trying to see like what they can do and sort of like experimenting maybe with exercise. How much like creativity is involved in that? Is it? Because like when I think of like physical therapy, I almost think of like opening an instruction book with like, here's the exercises that you would like prescribe to somebody or something. But
yeah. So first of all, sometimes you just have to let people do their thing, right? And then let people kind of experiment on their own. And some people actually do really well doing PTing yourself. So I'm always for that. I'm like, hey, do your thing. Learn about your body. If anything, that should be the goal. Is you're doing this stuff and you're like, oh, cool. Like I can actually bring my arm behind me, and not only are you learning about your body, but you're also building confidence in the things that you're doing. So I think that's great. I mean, if you really do need help, then maybe seek professional help. But hey, if it works, then it works. Why change that, right?
I just had to put it out there that I suggested.
Yeah. And that's like, I'm gonna cover myself. I told you. He didn't listen.
I'm very proud of you for PTing yourself, Joshua.
Yeah. Do your thing. We love it. We love to see it.
thanks.
I think when it comes to what you were mentioning of like figuring out what your patients or clients can and can't do, we have a structured assessment list. So we have a bunch of exercises that we run people through, starting with mobility, some stability, some breathing, and then we go into some of our capacity screens. So these are all things where over time and just based off the position, we know that it's a relatively safe position to put someone in. If people are feeling pain or they're feeling difficulty, like this is challenging, then that is enough for us to be like, okay, this is what your body can handle. But we also know that, again, asking the right questions about the pain is going to lead us in a direction of whether or not we can keep pushing them a little bit more. So we might not be doing a bunch of like exercises that are a bit out of the box, but we're definitely using these specific assessments and using different factors like tempo, like holding a position for a long time, like weights, like changing the weights, changing body like angles and all that, just to see what they can handle. Because some people will come in with knee pain, and like we're assessing a wall sit, one of the most basic exercises, usually as a punishment. You know, when you're younger, like you get punished and sit there for like 3 minutes and you're just crying the whole time. But
this sounds very personal.
Sounds like
this is it's a very specific situation. But people will come in and they're like, I can't handle it at 90 degrees. Okay, well, if we bump your butt up to 45 degrees, you're still getting the same stimulus in your quads. Oh yeah, I can tolerate this. Okay, cool. We'll work your way down to 90, right? So you have like your ideal, your optimal assessment.
Yeah.
And let's say they can't do it, then you adjust and you tweak little things here and there. You use physics and you change like lever arms, and that can give you at least as close as you can to the specific position you want them to be in.
I see. There's kind of two elements to it. Yeah.
Yeah.
I guess people have been doing this long enough that you figured out like some structure of
Yeah.
like what needs to happen for like, because there's probably a set of like really common injuries, right, that you're dealing with.
Yeah,
so
yeah.
you have this sort of like structured set of things,
Mm-hmm.
but then there's also the creative element where you're
Yeah.
sort of like adjusting things.
Totally. And I
Yeah.
think the creativity, more so the art of physical therapy, comes with more of like when you're trying to progress somebody through a program. So you can create the program itself. That's going to be their starting block. But then as time goes on, you're going to run into different problems of life things. Oh, I don't have access. I'm traveling. I don't have access to this, that, and, you know, like all the equipment that they have at home. Or I ran into a flare up and now I'm like, my back is maybe not 90% better. It's like 75% better. So then now you have to scale back and be creative of stacking exercises on top of each other of things that you know that gave them relief, and then but also still pushing them, moving the needle in the right direction. Like I use that phrase a lot, but because it's like every little inch or centimeter that you move the needle is closer and closer to what they need to get to. And sometimes you got to just bring it back just a bit in order to push it forward. So the creativity side is more of being able to manipulate the program, but also knowing how to manage the person. That's a tricky part.
Yeah.
Managing the person.
That's a hard thing for sure.
I understand wholeheartedly.
I was about to say, like, you probably relate.
This is something I'm feeling it deep in the feels.
In the soul.
Yep.
Yeah, that's the thing.
I'm curious to know, because we find ourselves asking these questions a lot too. What are the questions that you ask as they pertain to pain? So when pain arrives, like as far as the quality of pain.
Because you always say like things like pinching. Like the first thing I say.
Does it stretch? Does it? You know, there are like a bunch of different things that we kind of like just touch on.
I was like trying to learn the splits, and I was like, man, my hip flexors hurt. And he's like, is it pinching? I don't know exactly what that means, but no, it's not pinching.
Does it feel like that?
I just want to do that on camera. Okay. But the question was,
questions like asking about pain.
Yeah, when you're talking to a client and they present with pain, how do you go about finding out what the quality of pain is, and then going from there?
Yeah, pain is tricky because sometimes we have to figure out if it's a like, oh no, I'm in danger pain, or oh okay, this is actually something that you can tolerate. Because there's a lot of research now that shows like when you're dealing with certain injuries, it's actually okay to have some pain. So especially with tendons, like tendinitis or tendinopathy, things like that have been going on for a really long time. There is a window of pain that is okay when you're doing the exercise, but you also have to, again, put constraints on it and know you can't push it over a certain level, and you just have to keep it within a certain, pain level that will be okay. So using like the street light. Is it street light? Yeah.
Street light? Green, yellow, red.
The analogy of like green, yellow, red, and knowing, 1 through 3 is green, and then if it pushes into like 4 to 6, then you have to just be a little bit careful. As long as your pain doesn't increase as time goes on, then maybe it's something that's tolerable. But a lot of times, and I was explaining it to one of our clients recently, but a lot of where we get most of our data when it comes to pain is like the day after or like 2 days after. So you won't know the real effect of an exercise or a program or something until maybe a little bit of time after. And that's also what you have to incorporate into your program, but into like programming, I guess. Yeah. But when it comes to asking specifically about pain, we definitely ask, what does it feel like? Does it feel like it's like a dull underlying pain? Does it feel like it's sharp, like it just comes on and goes away? Does it feel like it's pinching? Like pinching is a good one, because if you're like bringing your knee up and you feel like, oh, I just feel a pinching sensation. It doesn't hurt, but it's just uncomfortable. Those things will give us an idea, or it's like a stretch. Those things will give us an idea of what kind of sensitivity it is. Usually when someone says like sharp pain, or like that's usually where I'll start asking them like, when did you start feeling it during the exercise? Sometimes it's immediately when you start the exercise. Sometimes it's after a certain amount of time. Sometimes it's after the exercise,
Right.
right? So we have to be able to differentiate if it's during the exercise, but let's say you're holding a position and it's like, oh, the pain didn't come on until 30 seconds in, then you know their body can handle 30 seconds, but nothing more. And then that's how you decide on how you dose this exercise.
Yeah.
Oh.
Yeah.
Right?
I was trying to figure out if like these sensations map back to like a very specific physiological thing. Like if somebody says, oh, it's like pinching in my elbow. Oh, that's because this ligament is doing this. And like, do you care about at that level, or is it more just like how you're figuring out now how to like dose the exercises rather than like mapping the specific sensation to like a thing that's happening in the body? Does that make sense?
It's less of that and more of just, I'm just trying to see what your body can handle.
Okay.
So what kind of pain that you're in is going to tell me a little bit more about the like what kind of capacity you have. So maybe if someone has like sharp pain, then I'm like, okay, then that's something we're going to back off on. There might be some tissue sensitivities that we don't want to push into. But if it's like, okay, I'm going again 30 seconds and then you start to feel like a dull achy pain that starts to creep up, then we'll just pause and say, okay, well, let's just scale back for now. Your body's obviously talking to us and telling us that it can only handle a certain amount, and then we kind of go from there. But knowing that sometimes it's this position might be more uncomfortable than this position, but you're working on similar things.
Right.
So that's how you know changing positions, changing times, changing tempos, changing weights. These are all things, or range of motion.
Yep.
These
100%.
are all things that change the way that the body handles. It's like safety. Your body's just looking for safety.
Yeah.
Right.
If you can create safety using these factors, then you can start to open up windows of opportunity for them to be able to do more and more. And kind of what you mentioned is when you're walking around with the band and getting into ranges of motion, what you're teaching your body is it's safe for me to get here and it's safe for me to move. And the more you expose your body to certain things or certain activities or positions that your body wasn't in before, it just kind of gets used to it. And we hear this a lot, which was like, we'll put someone in a position and initially their body's like freaking out because like, whoa, I don't know this. I'm very uncomfortable. And then we do it again and we do it again. And then by the third rep, they're like, or the third set, they're like, oh yeah, it feels way better than when I first started. But it just needed to learn a little. So we also monitor those things as well. Is if you're feeling uncomfortable in the beginning, but then after a couple sets and reps, your body feels better, then it's telling me that it's positive. It's a positive net. Your body actually likes it. It's just a matter of developing a little bit of understanding of that.
Yeah.